Types of IV fluids, and this topic was requested by Posh BTHY. Don't forget to request your topic in the comment section. The body is always trying to maintain a good balance of fluids in the intracellular, inside of the cell, or the ICF, and the extracellular, outside of the cell, or the ECF. Depending on the patient's medical condition, the body might try to pull fluid out of the cell or push fluid into the cell. This is where IV fluids come in. They help to facilitate that movement of water either into the cell or to pull fluid out of the cell. With the help of our friend osmosis, water tends to move from an area of lower concentration to an area of higher concentration. And this is important to remember when you think about your types of IV fluids. When you as the nurse administer an isotonic fluid, iso means equal. Tonic is talking about the concentration. It is only going to cause a good balance of the ICF and the ECF. It does not cause water to move from any compartment to the other. You see isotonic fluids used in patients who are dehydrated, have some blood loss, or honestly about to go into surgery. The 0.9 normal saline. When you as the nurse administer a hypotonic fluid, we know that hypo means low, so this is a fluid that is a lower concentration. Osmosis causes water to flow from an area of a lower concentration to a higher concentration. So when you administer a hypotonic fluid, water is going to flow into the cell. Water leaves the ECF and flows into the ICF. A hypotonic fluid is used a lot when the cells are dehydrated. So the water is flowing into the cells to hydrate them. 0.45 normal saline or your half normal saline. Do not use this type of fluid for patients who have an increased intracranial pressure or at risk for cerebral edema, because that cell is already filled with water, and honestly, we don't want to put any more in there. When you as a nurse administer a hypertonic fluid, hyper means high and tonic is referring to the concentration, you are administering an IV fluid that has a high concentration. Osmosis causes water to move from an area that has a lower concentration to a higher concentration. So when you pour into that patient's body a hypertonic fluid, guess what's going to happen? Water is going to be pulled out of the cell. Water will actually flow from the ICF into the ECF. And why do you think we would need that? We use hypertonic fluids in conditions where we are trying to actually dehydrate the cells. So we want them to shrink a little bit because they're too plumped up. Conditions like cerebral edema. This is the main concept behind understanding IV fluids and how they work in the body. If you found this video helpful, send this to another nursing student who might find it helpful as well. Save it for next time you're studying. Good luck to you all. Bye.